Good morning everyone. Today we'll discuss about the functions of hemoglobin, metabolism and synthesis of hemoglobin and different porphyrias. Coming to the biochemical importance, at the end of this session, everyone should be able to know what are the biochemistry of porphyrin and what are the bile pigments and how is heme synthesized, the different steps and porphyrins and iron. And the biochemistry of porphyrin of heme and the basic for understanding the varied functions of the different hemoprotein. And we also have to understand the importance of porphyrias, which is a group of disease caused by the abnormalities in the pathway of porphyrin biosynthesis. So again, the biochemical importance. Jaundice is very common. So what is jaundice? And it's a much more common clinical condition, a consequence elevated where there is increased level of plasma bilirubin due to either overproduction of bilirubin or due to failure of excretion. So jaundice occurs in numerous diseases ranging from hemolytic anemias to different viral hepatitis to cancer, especially the cancer of head of the pancreas. Formation of heme involves incorporation of iron into protoporphyrin. So how the final step of heme synthesis involves incorporation of ferrous iron into protoporphyrin in a reaction catalyzed by ferrosilitase, that is heme synthesis, the mitochondrial enzyme. The last three enzymes, pathway synthase located in the mitochondria, the other enzyme is cytosolic. So both erythroid and non-erythroid housekeeping form of synthase are found. So heme biosynthesis occur in most mammalian cells with the exception of mature erythrocyte which do not contain mitochondria, as I mentioned earlier. Synthase is the key regulatory enzyme in hepatic biosynthesis of heme. So two isoenzymes of synthase 1 expressed throughout the body and synthase 2 express erythrocyte precursor cells, and reaction is catalyzed by synthase 1. So this is the reaction which we have discussed earlier, how porphyrin is formed. So rate limiting reaction of biosynthesis of heme takes place in the liver. Heme, probably acting through an aporepressor molecule, act as a negative regulator of the synthesis of synthase 1. So the intermediate enzyme and regulation of heme synthesis is here: hemoproteins, then proteins, then ferrosilitase, protoporphyrin oxidase, and coproporphyrin oxidase, uroporphyrin decarboxylase, and uroporphyrin third synthase, and uroporphyrin 1 synthase, and 2 dehydratase, and finally the synthase. And this is the how heme synthesis is regulated. So the succinyl CoA and glycine is condensed, and so how heme act as a aporepressor we can see from this diagram. Rate synthesis of synthase 1 increases greatly in absence of heme and diminishes in presence of heme. So heme affect translation of the enzymes. It transfer from cytosol to the mitochondria. So synthase 1, which is a short half-life typical for an enzyme that catalyzes a rate-limiting reaction. Many drugs whose metabolism require the hemoprotein cytochrome P450 increases cytochrome P450 biosynthesis. So resulting repletion in the intracellular heme pool induces synthesis of the rate-limiting enzyme synthase 1. So the rate of heme synthesis rises to meet metabolic demand, and biosynthesis of synthase 2, the not feedback regulated by heme and nor induced by drugs. So now coming to the porphyrins. Porphyrin are colored and fluorescent. Porphyrin, which is colorless, it will be converted to porphyrin and which become colored. The conjugated double bond of pyrrole rings linking methylene group porphyrin absent in porphyrinogen responsible for their characteristic absorption and fluorescence spectra. These visible ultraviolet spectra, porphyrin and porphyrin derivatives, which are useful for their identification. So this is the absorption spectrum of hemoprotein. So the diagram shows the spectrum of 0.1% solution of hematoporphyrin in 5% hydrochloric. The sub-absorption band near 400 nanometer, there is a distinguishing feature shared by all porphyrin termed as Soret band. After the discoverer, the scientist, French physicist Charles Soret. So porphyrins dissolve in strong mineral acid in inorganic solvents illuminated by ultraviolet light emit a strong red fluorescence, a property often used to detect small amount of free porphyrins. So photodynamic properties of porphyrin have been suggested. They are possible use in the treatment of certain type of cancer, a procedure which is known as cancer phototherapy. The tumor then exposed to an argon laser to excite porphyrins, then producing cytosolic effect. So spectrophotometry is used to detect porphyrin and their precursor. So this coporphyrin, uroporphyrin are excreted in increased amount in the disease, that is the porphyrias. When present in urine or feces, they can be separated and extracted with appropriate solvents, then identified and further quantified using spectrophotometric methods. So what are the disorders of heme biosynthesis? So disorders of heme biosynthesis may be genetic or acquired. An example is acquired defect by lead poisoning. And lead can inactivate peroxylase, then allow dehydratase by combining with essential thiol group. Sign includes elevated level of protoporphyrin in the erythrocyte and elevated in the urinary level of coporphyrin. Then genetic disorder of heme metabolism or bilirubin metabolism share the following feature with the metabolic disorders like during urea biosynthesis. So similar or identical clinical signs, symptoms can arise from different mutations, genes that encode either a given enzyme or an enzyme that catalyzes a successive reactions. So rational therapy require an understanding of the biochemistry of the enzyme which catalyze the different reactions in both normal and impaired individuals. So identification of intermediate side products that accumulate prior to the metabolic block can provide the basis for metabolic screening tests that can implicate the impaired reaction. So definitive diagnosis involves quantitative assay of the activity of the enzymes that are defected, and comparison of DNA sequence gene encodes a given mutant enzyme to that of the wild type gene can identify the specific mutations that cause the disease. So now coming to the porphyrias. The sign and symptoms of porphyria result either from a deficiency of intermediate beyond by the enzymatic block and from accumulation the metabolic prior to the block. So this is the summary of major finding in porphyrias. The enzyme involved allows synthase 2 type, class and number, that is X-linked sideroblastic anemia. The major sign symptom is anemia, and the results of laboratory tests red cell counts and hemoglobin is decreased. And the enzyme involved is allows dehydratase 2, the old dehydratase, allow dehydratase deficiency. Number 2, that is allow dehydratase. So here the allow dehydratase deficiency sign and symptom is abdominal pain, neuropsychiatric symptoms, and the results of laboratory test is urinary ALA and coporphyrin 3 is increased in the urine. Then uroporphyrin synthase, this is acute intermittent porphyria. The sign and symptom is abdominal pain, neuropsychiatric symptoms, urinary ALA and PBZ is increased. And uroporphyrin 3 synthase, it's a congenital erythropoietic, and photosensitivity is a sign and symptoms. Laboratory test, urinary, fecal, and red cell uroporphyrin is markedly increased. And uroporphyrin decarboxylase, which is Porphyria cutanea tarda, is photosensitive. There may be severe changes on the skin, and here the laboratory test we find urinary uroporphyrin is increased. Then when the enzyme defect is coproporphyrin oxidase, the hereditary core porphyria, so there will be signs of photosensitivity, abdominal pain, neuropsychiatric symptoms in the laboratory, urinary ALA and PVZ, and core porphyrin 3 and fecal core porphyrin is increased. Then protoporphyrin oxidase is the enzyme defect, that is it will produce variegate porphyria, and the sign and symptom is photosensitivity, abdominal pain and neuropsychiatric symptoms. And again here there will be in the urine this ALA, PPG and coporphyrin 3 and fecal protoporphyrin is increased. And finally, if the enzyme defect is peroxylase, the porphyria is erythropoietic and there will be photosensitivity in the major sign, and in the result of laboratory test there will be fecal and red cell porphyrin 9 is increased. So there may be also congenital erythrophytic porphyria Most porphyria are inherited in an autosomal dominant manner. Congenital erythropoietic porphyria is inherited, which is a recessive mode, and the defective enzyme, that is congenital erythropoietic porphyria, uroporphyrinogen third synthase, the catalyst for the reaction number 4. The photosensitivity and severity of erythropoietic porphyria has suggested them as a prototype, and they are also called werewolves. Then coming to acute intermittent porphyria, the defective enzyme here in acute intermittent porphyria is hydroxymethylvaline synthase or uroporphyrinogen synthase, the catalyst for reaction number 3. ALA and porphyrinogen will accumulate in the body tissues and in the body fluid. So here the biochemical basis of the major signs and symptoms of porphyria. There will be mutation in various genes. It will produce abnormalities of the enzyme of heme synthesis, and further there will be accumulation of ALA and PPG or decrease in heme in cells and body fluid, and this will produce neuropsychiatric signs and symptoms. On the other side, accumulation of porphyrinogens in the skin and tissue, there will be spontaneous oxidation of porphyrinogens to porphyrins, and this will produce photosensitivity. So neuropsychiatric sign and symptoms and photosensitivity are the main sign and symptoms of the different porphyrias. So again, there may be blocks later in the pathway. So block in the later pathway results in accumulation of the porphyrinogens. Their oxidation product, the corresponding porphyria derivatives, cause photosensitivity and visible light about 400 nanometer wavelength. Possibly as a result, their excitation reaction with molecular oxygen, the resulting oxygen radical injure the lysosome and other subcellular organelles, releasing the degradative enzymes that cause variable degree of skin damage, scarring of the skins. Coming to the classification of porphyria, porphyria term erythropoietic may be hepatic based on the organ most affected, typically bone marrow and the liver. Different variable level of heme toxic precursor or metabolite probably account for why specific porphyrias differently affect some cells and organs. Alternatively, porphyria may be classified as acute cutaneous based on their clinical features. The diagnosis specific type porphyrias can be generally established from consideration of the clinical presentation, the family history and physical examination, and finally by appropriate laboratory tests. So this is the skin showing the scarring in case of Porphyria cutanea tardia, is the sign of photosensitivity. So this is the color urine from a patient with Porphyria cutanea tardia, which is in the right side, and from patient with normal Porphyria in the left side. So the high color urine we can see in Porphyria cutanea tardia. So drug-induced porphyria is there. So certain drugs, barbiturate, riboflavin, induce the production of cytochrome P450 in the inpatients with porphyria can precipitate an attack of porphyria, depleting heme levels. The compensation de-repression of synthesis of ALA synthase wall results increased level potentially harmful heme precursors. And possible treatment for porphyrias. So what are the possible treatment for porphyrias? While treatment at the gene level may ultimately become possible, the present treatment of porphyria is essentially symptomatic. Includes avoiding drugs that induce production, cytochrome P450, and ingestion of large amount of carbohydrates, and administration of hematin to depress ALA synthase 1 synthesis to determine production of harmful heme precursors. Patients exhibiting photosensitivity benefit from sunscreens and possibly from administration of beta-carotene, which is free radical decreasing, and photosensitivity will be reduced. So these are the structure of uroporphyrin 1 and uroporphyrin 3. Here A stands for acetate and P stands for propionate. Pathway of porphyrin synthesis and how porphobilinogen is formed, and inhibitor early poisoning, and in acute intermittent porphyria, the block, the site of the block, and this erythropoietic protoporphyria, where is the site of block, and Viryabati porphyria, the site of block is indicated here, and in case of hereditary coporphyria, site of inhibition is indicated here. And further, Porphyria cutanea tardia, the site of inhibition or defective enzyme is showing here, and congenital erythropoietic porphyria, the enzyme defect, and where is the site of the reaction which is defected. This diagram shows the summary of heme synthesis and the abnormalities of heme synthesis resulting from different enzymes of heme synthesis.